Do you get flu shots?
I do.
You don't think
Do
bad?
you?
You don't think bad of me that I don't?
To each his own, Reg.
Okay. You?
Yeah, you're gonna bring the flu.
Oh, now you're making me feel bad. We're just a week into the new year, and we're seeing how bad this flu season is shaping up to be. That's why we want to get to the bottom line of what you need to know to protect yourself and your family.
So we came up with 3 flu facts after checking in with the Florida Department of Health in Hillsborough County. Here we go.
First, the flu season is really hitting people hard because of the strain of flu that is going around. H3N2 will cause severe illness, so those who are getting infected are feeling much worse than with some of the other strains. It's the same strain that hit 3 years ago, but fortunately this time around, half as many patients have ended up in the hospital so far, so doctors are hopeful there will be far fewer deaths.
Fast fact for you, number 2, the best way to fight the flu is to see your doctor. If you get in the office within the first few days of symptoms, you can get an antiviral like Tamiflu. You might not want to waste your time or your money on over-the-counter medicine.
Over-the-counter medications are going to be treating flu symptoms, the symptoms that you get while you have the flu virus. They're really not going to do anything about the virus replicating inside your body. Your doctor can test you for influenza as well as give you the correct prescriptions for antiviral medications that would help prevent the flu from getting worse.
Now, fast fact number 3, the flu shot is your only option for a vaccine. The flu miss wasn't capable of preventing flu this time around, so you're going to have to roll up your sleeves on this one. Doctors stress it's not too late to get the vaccine, and even if it's not highly effective, it could lessen severity if you do get the flu. And we can't stress enough, we are far from the end of flu season. According to the CDC, flu activity usually peaks in the month of February. After March, flu cases drop off dramatically, but flu season can last until May.
And if that didn't get your attention, listen to this. There's high flu activity in more than 24 states, and that includes Florida. In Miami, hospital administrators are putting up flu tents. The 8 to 9 hour waits to be seen in the emergency room in San Diego have already forced doctors to start seeing people outside in triage tents. Thousands of people are trying to get help to fight the flu, which has killed dozens already across the country. There's a backlog in coding, so the stats aren't even available to the CDC, but it has confirmed 13 babies have died.
Kids are also coming into the hospital with respiratory problems, fevers, and then they're getting diagnosed with the flu. Now, doctors tell us this flu isn't the regular one that would give you a couple of days of a runny nose. And because this strain is especially dangerous, children's developing immune systems are having many more complications.
About 4 days ago, he started breathing hard, vomiting, having fevers. I just want him to get well.
Nurses are treating 8-month-old Kingston with a nebulizer. And if your kids are having a fever or difficulty breathing, it's time to call the doctor.
Just a week ago, we verified hospitals are facing an IV bag shortage. It's not what you want to hear when the flu is dehydrating people. Some hospitals are trying to conserve what's going on, and others are looking to other options like manually giving patients fluids, things like Gatorade. That's time consuming for the staff, and doctors say that if the flu season does get worse, that could really push it to the limit.